Welcome to the new sound of online radio. Welcome to the sound of Universal Broadcasting Network. 'Cause you make me feel like I've been locked out of heaven. A mix of today's hits and hard-to-find favorites, combined with the most entertaining and intriguing talk anywhere. This is your sound. This is the sound of Universal Broadcasting Network at UBNradio.com.
You're listening to the Dr. D Show about neuropsychology and well-being. Get the knowledge you must have to live a powerful, positive life. The Dr. D Show. Here for you.
Welcome, listeners, to the Dr. D Show today. It is wonderful to have you with us. As you know, this is a psychoeducational show. In essence, it's not meant to replace professional mental health advice or therapy. If you do believe you suffer from a particular disorder, please do reach out to professional help. With that in mind, the topic of today is continuously showing up in media outlets and the news and in various kinds of research facilities and platforms of neuroscience. We are going to talk about Alzheimer's today. And what do we know about Alzheimer's? What do we need to know? What's some things we need to consider? And what types of studies are out there now that individuals can consider participating with? So what's better than the Alzheimer's Association, an organization that's dedicated to the study of the problem or the disease, and actively has hundreds of amazing individuals, thousands of individuals combined, who are either volunteering for the cause, studying the problem, researching solutions that we can have, and providing information for the society and the public about the disease. So we are excited to have with us a Senior Director of Medical and Scientific Operations at the Alzheimer's Association, Dr. Snyder. I think that we have a lot of hope when it comes to Alzheimer's. And I know closely what the disease looks like because I diagnose and treat on a weekly basis, most of the time, individuals who are eventually diagnosed with Alzheimer's. I'm very familiar with this condition and what toll does it take on individuals and their family members. And it is one of those diseases that we hope, we want, and we pray to see that research will discover solutions and cure to the condition. And so one reason why I feel that we should have great hope about this situation is because in the past about 6 months, at least 5 or 6 prominent research locations have brought out publications that show promising results of experimental trials that are going to help in curing Alzheimer's or treating Alzheimer's. We're talking about from destruction of proteins that are involved in Alzheimer's to increase of activity in the brain that can promote healing, to early detection of the disease, and to what types of treatments individuals can do to prevent themselves from developing Alzheimer's, or rather reduce the risk of developing eventually Alzheimer's. One other reason why this is becoming more and more important is because we have entered the period of time where we are going into the baby boomers, right? Or the population, the aging, the tremendous large piece of the American population that is now aging and is entering that higher risk of developing not just Alzheimer, but other types of dementias. And so this is the time to find solutions. With that in mind, I would like to have with us our interview on the call. Dr. Snyder, are you with us?
I am. Thanks so much for having me.
Welcome to have you on the show. We are very excited to be able to get great information today. With your permission, I'm going to go ahead and read your bio for our listeners so they know just a bit more about you. Dr. Snyder
That would be
is
great.
Dr. Snyder is a senior director of medical and scientific operations at the Alzheimer's Association. She manages the association's international research grant program, through which the association funds research around the world. Dr. Snyder oversees the association's relationship with the leading disease journal in clinical neurology, Alzheimer's and Dementia, the Journal of the Alzheimer's Association, and its two companion open access journals. She is responsible for implementing the Alzheimer's Association's Women's Alzheimer's Research Initiative. That's very interesting. And leads the association's efforts to understand the role of vascular factors in Alzheimer's and dementia. Well, for sure, offline, I will have some other questions for you. Now I know. Dr. Snyder received her PH.D. from Loyola University, Chicago. Stritch School of Medicine. Her bachelor's degree is in biology and religious studies from the University of Virginia, and she completed her postdoctoral fellowship at Children's Memorial Research Center, affiliated with Northwestern University in Chicago. Welcome to the show, Dr. Snyder.
Wonderful. Thanks so much for having me.
So I was just beginning to tell our listeners how hopeful I am in terms of the area of Alzheimer's. We have various kinds of research facilities, prominent locations all over the world that are actively working on developing solutions, looking at both from detection to treatment, management, and hopefully we're going towards prevention of Alzheimer's. But before we go into that, how about we give some basic review to our listeners? What is Alzheimer's disease?
Alzheimer's disease is a progressive brain disease, and it's fatal. It is the sixth leading cause of death in the United States. As the individual progresses through the disease, they experience problems with their thinking, their reasoning, their memory, and ultimately it is fatal. It causes the individual to forget how to swallow, to forget how to use their tongue, and ultimately how to breathe. We know that there is currently no way to stop or slow the progression of this disease, but to your earlier point, there is hope, and there is hope in research.
And you know, sometimes the question that I get, so one of my areas clinically is dementia. And one of the main questions that always comes about is, well, why does it matter? Why should I know whether it is Alzheimer or another type of dementia? If my neurologist said that I have dementia, why should I care to find out which type it is?
Yeah, no, great question. And when we think about the different types of dementia, the different causes of dementia is really that umbrella term. It in and of itself is not a specific disease. It's more the symptoms of the changes in memory, thinking, reasoning. And there are many causes of dementia, Alzheimer's disease being the most common cause. But there are causes of dementia, for instance, that could be reversible. So there are hormonal imbalances, nutritional imbalances, for instance. And so that's really why it is so important to speak to your healthcare provider. But also, if you have Alzheimer's disease or if you have another type of dementia, like frontotemporal dementia, there may be differences in your treatment, differences in what you might expect in terms of the progression of the changes. There might be differences in terms of your care management, some of the symptoms that an individual might experience. And so for your loved ones or for your care, the individuals that are helping you provide your care, it's also really important to understand or to know what's the specific cause of dementia. And in fact, the Alzheimer's Association is leading a clinical study right now called the IDEA study to do just that for individuals that have that may be a difficult to diagnose cause of dementia, that they could use one of the developing technologies where you can take a picture of the brain and determine if there is a buildup of one of the hallmark brain changes in Alzheimer's called amyloid, beta amyloid. And again, does that then change the outcomes? Does that change the care? Does that change the treatment for the individual? And being able to look and assess that. Because we know that there are differences, and we know that the current medications for Alzheimer's don't necessarily work for some of the other causes of dementia.
Right, and I like what you're saying because you're talking about medications, and we do know that some medications can be very helpful, especially in the early stages of Alzheimer's, but actually might even be harmful to a different type of dementia or contradict with other medications.
Absolutely, and it is important to understand for listeners that the current medications that are available for Alzheimer's disease, they're symptomatic. So they are really helping to treat the individual symptoms, that change in the loss of memory, thinking, and reasoning. There is no current way to stop or slow the progression of the disease, although, as Dr. D mentioned, there is a lot of work going on to try to identify some intervention, whether it's medication or lifestyle, to do just that, to stop or slow the progression of the disease, as well as numerous efforts around prevention, getting in, helping an individual at the earliest stage before our loved ones are losing their memories.
Mm-hmm. What you're saying is so important because you're talking about being proactive, and we know that individuals and their family members, when they decide to take a proactive approach and make a lot of good changes in their lifestyle and treatment, may have a different prognosis than individuals who decide not to take on the situation in a proactive way.
Yeah, absolutely. So last year, the association actually took a look at all of the science that we see. We hear so many things, eat this, don't do this, engage in this activity, don't engage in this. And so we really felt that for our constituents, it was so important to take a look at what the science says. What does the science tell us about healthy lifestyle choices and behaviors that we can engage in? And what does that mean for our later life risk? And really looking at the science, we can talk more about brain health. What are things that we can do? What are behaviors that we can engage in that are going to keep our brains as healthy as we can as we age? And really coming off of that with, here are 10 different behaviors, the 10 ways to love your brain, that are things that you can do now that are going to help keep your brain as healthy as you can as you age. And it's important to realize it's not going to be one of them. It's not being just physically active or keeping your brain active or eating a brain-healthy diet. It's actually doing all of those things together. And there are studies that are happening that are using very specific lifestyle recipes, if you will, or intervention recipes that show that really putting all of those things together is going to be the most beneficial for keeping our brains healthy as we age.
Absolutely. We in so many conditions, we wish that there was a magical pill that would fix our marriage, would fix diseases, would fix, can I just take that one pill and that's going to do the job? And it's just not realistic. And also one other area you touched on, which I thought was very important, is we have to be a little bit stingy with our hope and be careful, because when we're not basing the type of treatments that we're choosing or where we're putting our efforts in, we might erroneously put a lot of our hope and efforts, whether those are financial or emotional or physical, into something that is not supported by science, and could be actually harmful to us, because we're wasting years that we can get real work done, and we're wasting that hope that we're talking about, that internal energy that we've got, instead of putting it in something that's truly important. So.
Well, and I think there are so many things that are hopeful, and there are so many things that we can do today. And the Alzheimer's Association really prides ourselves as the largest voluntary health organization in the world dedicated to Alzheimer's and related dementias, as being that resource for families, that when you see something or you have questions about the science behind whatever you might read, that we're there to answer those questions. And we have our website that stays updated with information, but we also have points of service in communities all across the country. We have a 24-hour, 7-day-a-week helpline that you can call and ask that information at 1-800-272-3900, and really to that point of being able to provide that accurate information for individuals to make the choices themselves. What does the science tell us? What's the information? And then really making the decision that's right for you and for your loved one going forward.
Mm-hmm. And going back to the area of diagnosis, just so individuals understand, what is the difference, for example, when you're thinking about vascular dementia versus Alzheimer's, we often expect a different type of progression, with all else being equal. Why is it important for individuals to know that, some dementias behave one way and other dementias behave in another way?
Yeah, again, it's both important for the individual to understand what they might be experiencing looking forward. So if they're in the early stages of the disease, what's going to happen? What are things that they should expect? What are the changes that they should expect in themselves? But also for their care partner, for their families, to understand what's happening to their loved one. We know that that's actually really important for the care partner, for the family, to have that information, to understand what's happening to mom, to dad, to their husband, to their wife, to their sister, to their brother, to their partner. And being able to understand that actually is a big part of the providing care and support for a loved one. I actually I was in South Carolina recently, and I met a woman who, after I had given a talk about research and the disease and what is Alzheimer's, came up to me at the end and said, "Thank you. I now understand that what my husband's doing is not his fault. He's not just trying to drive me crazy, but actually these are changes that he can't control. And this is going to make me a better carer, a better partner to him throughout his disease." And I think that's a really important message, and the science backs that up. And in fact, that is the case.
It's a great
and
diffuser. What you're saying is so on point, because it's a great diffuser of the type of tensions that normally happen in interpersonal relationships with our spouses, with the children, with anyone who maybe is a caretaker to us or we get involved with, and often. Let's talk a little bit about maybe the stress that happens when an individual starts suffering from decline, from a cognitive decline, but maybe they're still working, they still have responsibilities. Let's talk about that stress a bit.
Yeah, the stress is one of those, we all respond to stress differently. Men respond to stress differently from women, depending on how old we are, or the other parts of our lives, children, parents, jobs, etc. There's a lot of components when we think about stress, and it's part of why it's so complicated to really understand what the role stress is playing in terms of either our underlying biology. What is it doing to our underlying biology? May it impact our later life risk? Does it increase our progression? All of those pieces are really important questions when we think about stress. But I think the other side of it, and this is probably a little bit to your point, is when you're a carer or you're a care partner for somebody that has Alzheimer's disease or related dementia, there's a whole other type of stress of what type of day is it going to be? What are the things that you need to do? How do you balance providing care and support for your loved one with all of your other responsibilities? And in my own family, this is something that my in-laws deal with. They're providing care and support with our grandmother that lives with them with Alzheimer's disease and has for a number of years. And as the years have gone on, the level of stress has increased significantly for them in terms of the worrying that they have and all of those other pieces. Knowing you're not alone is important. Knowing that there are resources like the Alzheimer's Association, like other families, other carers that are in your community as well is really important. And having that type of connection is really important going forward as well.
Yeah, and that really goes to the point how important it is also for caregivers to have their own support groups. So not only they can get that emotional support, but also understanding and confirmation from other individuals who go through the same thing, and sometimes get good ideas too, various kinds of solutions. I used to run those kind of groups, and I found them so helpful in so many ways.
Absolutely.
Now, what populations, so we want to talk a little bit maybe about statistics. What populations are at a higher risk of developing Alzheimer's?
So, one of the things with Alzheimer's disease is it doesn't discriminate, that there are a number of different factors that seem to maybe hint at why somebody might be at an increased risk, but when we look at the population, we know that it's about 1 in 9 over the age of 65, so age is certainly a factor, and about 1 in 3 over the age of 85 will develop Alzheimer's disease. We know that it hits all of us, and it has the potential to affect all of us. African Americans in the United States are 2 times more likely, and Latino Americans are 1.5 times more likely to develop this disease as well. And we don't completely understand those reasons. And to one of the comments you made at the very, very beginning, we also know that there are more women than men that are living with Alzheimer's disease. And we don't completely understand why. We don't know if it's that women are at a greater risk, or it's that women live longer, or they live longer with the disease, or there are other biological or genetic reasons for that, for why there are more women than men. But that is certainly something that we see in the numbers of people that are affected by this disease. And it's not just the United States. It is a global problem. There are over 47 million people in the world living with Alzheimer's disease or related dementia.
So I had one listener that saw that we're going to have this topic today and sent me a question. Well, isn't Alzheimer's is just a result of being very old? Isn't that a natural process of aging?
Yeah, that's one of the lasting myths that when we talk about Alzheimer's disease, it is not normal aging. In fact, if you look at the brain of an individual, around the same age or even much older, with comparing it to someone with Alzheimer's disease, there are actually physical changes that you can observe. For instance, a change in the overall volume of the brain. So you see it's smaller in size. You see much bigger gaps between different parts of the brain. And then if you actually look under a microscope and you look at the very fine detail of changes, you see two hallmark brain changes. You see this buildup of what we call plaques between the cells. The primary component of those is a protein known as beta amyloid. And then within the brain cells, you'll also see a clump that looks like a giant hair tangle, and they're called tangles. And the primary component of those is a protein called tau. And those are not present in normal aging. Those are specifically present in Alzheimer's disease and are part of how we define Alzheimer's disease.
Now, so let's say an individual is suspecting that they might be suffering from a cognitive disorder and they want to get clarification, or the neurologist detected that, or maybe a family member. What is the process of getting diagnosed?
Yeah, so, if you are concerned about yourself or a loved one, you should speak to your healthcare provider if you have someone you trust, or if there are major centers across the country that specialize in Alzheimer's disease and related dementias, as well as memory centers across the country that specialize in this. So speak to your healthcare provider and determine if they are able to do a diagnostic workup, or if they want to refer you to someone else in the community that might. Of course, the Alzheimer's Association can also help provide those types of references or resources as well to families. It's a full diagnostic workup typically. Again, there are types there are causes of changes in memory, thinking, or reasoning that might be due to a nutritional or a hormonal imbalance. And so it's not just a workup of your memory and your thinking and your reasoning. It's actually a much more broad workup so that you can determine what might be rule out some of those causes that could potentially be reversible. And then go through a series of tests that actually allow your healthcare provider to assess your memory, your thinking, your ability to reason, and some of your overall function.
You touched on
talk
something
to,
very
your partner, right, as well.
Absolutely. And you also touched on something important, which it could be a different diagnosis sometimes, or a condition that is reversible. What comes to mind for me is just as simple as a UTI, urinary tract infection, and how it can cause a temporary mimicking like cognitive disorder or confusion, the type of delirium that we talk about. Which might not be then the diagnosis, a more of a permanent diagnosis of a progressive condition like Alzheimer's. And that's why it's so important to do the full workup with trained professionals. Now, the role of being that I'm a neuropsychologist, and we often touch on that on the show, what is the role of neuropsychology in those types of evaluations?
Yeah, so sometimes they are the expert that is doing the cognitive assessment of an individual, or providing input in terms of the cognitive assessment once the results are once you have the results and you kind of have the full the full grouping of the different tests that have been done. Again, sometimes they are the expert doing the entire workup.
Mm-hmm. Yes, and the clarification, sometimes what I find when we do the neuropsych component of that is, especially in the beginning stages, but even later on, is to really hone into which types of cognitive areas we are seeing an actual functional impairment? Is it attention and is it just memory? Is it more attention and concentration? Are we seeing decline in speech or in the verbal capacities? Is it primarily a visual spatial decline or a combination of both? Where we are in terms of executive functioning, which we talk a lot about in the show. So it is important to get the variety of professionals, and often when you're in a good team, you will be receiving a comprehensive evaluation to get all sorts of answers for the best treatment option. So what types of treatment is generally recommended? And of course, always as a disclaimer, never try to diagnose yourself. Always go to professionals, and every person has got their own situation and condition. So just for you listeners at home, remember always your treating physician is going to be the one to determine the types of treatment and the best treatment combination that is good for you. But when we think in general about treatment recommendation, Dr. Snyder, what would be those treatments for Alzheimer's?
Yeah, so again, to your point, it's so important to speak and make these types of decisions with your healthcare provider, because there's lots of different factors that might come into play for a specific individual, depending on the extent of their changes in memory and function, and what their specific diagnosis might be. For an individual with Alzheimer's disease, there are 5 FDA approved medications for Alzheimer's disease. Again, they are symptomatic, meaning that they treat the underlying symptoms of the disease. There is no evidence that they are stopping or slowing the progression of the disease, so the underlying biology continues to progress and go forward. They are symptomatic. They make up 2 different classes of drugs. And essentially their primary function is they help the brain cells that even though the cells are continuing to die, the brain cells that are still present, they help them talk to each other longer. So they're almost like a hearing aid for the brain cells. That even though brain cells are dying, they're continuing to turn up. You can turn up the volume on your hearing aid and continue to hear more and more in the surrounding environment. But ultimately, and eventually, you're not able to keep turning your hearing aid up enough because the hearing loss becomes so progressed. And it's like that with Alzheimer's disease and with these symptomatic treatments. The combination, they can be used, the 2 different classes can be used in combination, but again, that depends on the individual and the stage of the disease and in terms of the severity of the memory loss that they might be experiencing. Then there's also other interventions that we know that families might try that revolve around behavior and lifestyle. None of them are approved. We don't really know exactly how they might benefit, but we do see some of those are also recommended. Again, that the overall brain healthy lifestyle recommendations that somebody might engage in, whether it be physical activity and continuing to engage their brain. All of that depends on the individual, the stage of the disease, and where what they might have access to as well.
Now, there's a type of Alzheimer's called familial Alzheimer's disease, and that's its own unique condition. Could you kind of explain to us what that is?
Yeah, about 1% of the millions of individuals around the world that are living with Alzheimer's disease have what we call familial Alzheimer's disease, or dominantly inherited Alzheimer's disease, meaning that it is caused by a genetic misspelling in their DNA, in their underlying makeup, that will determine that they will develop the disease. And they will not only develop the disease, they will also develop it at the same estimated age of onset that their parent, because they inherited that misspelling from their parent. It allows those individuals tend to also develop the changes in memory, thinking, and reasoning at a much younger age of onset. So in their 20s, potentially 30s, 40s, and 50s. It does run in families, so it runs both vertically and horizontally across families. And if it's in your family, if you have one of these inherited misspellings, then you generally know, because you will have Alzheimer's disease at a much younger age of onset, and in at least 50% of that particular family line. There are a number of trials and a number of this these families have a network called the Dominantly Inherited Alzheimer's Network that's headquartered out of Washington University in St. Louis. And they've actually now taken that network and they've developed clinical trials called the Dominantly Inherited Alzheimer's Network Trials, or DIAN-TU. The Alzheimer's Association is very proud of the fact that we helped to establish that underlying infrastructure to launch those studies going forward. Because in a general population where we don't know who's going to develop the disease and we don't know when, you have a defined population of people, we do know who, and we do know when. And this allows you to actually say, well, the underlying biology is changing. They don't yet have the memory changes. We can intervene earlier with a potential medication, an experimental drug, and say, are we able to change the underlying biology? Are we able to slow or stop the progression of the disease? And those trials, those are some of the ongoing prevention trials right now and are really exciting in the field.
Yes, this is wonderful. And like you said, the more we know, the more control we have over what we're able to do for the population. So and it's a great group to be able to study. Now, what should, actually, the next question I would really want to ask first is genetic testing. So it has become more and more popular for individuals who are suspecting or are worried about potentially developing Alzheimer's to go and get genetically tested. How accurate is it, and what is it all about?
Yeah, great questions, and this is actually a question that we get all the time. So when we talk about, I talked a little bit just now about familial Alzheimer's or these families that have what we call deterministic genes, and that, again, determines that they will develop the disease. But there's about 30 or a little over 30 genes that have been identified to increase an individual's risk. The most well-characterized of those is a gene called ApoE4.
Right.
And that, if you have one copy of that, you're increased risk. If you have two copies, you're at a greater risk. For the other 20-some-odd genes, in some cases, we don't even know the function of the gene. We don't know actually even what it does. So there are genetic tests, as you said, that can test whether you have one or two copies of this ApoE4. At this point in time, though, because we don't really completely understand the role of these genes, and again, they increase your risk, but they by no means guarantee that you will develop the disease. If you have a first-degree relative, so that's a parent or a sibling that had Alzheimer's disease, you already know you're at an increased risk, and there's not much more that a genetic test is going to tell you based on our understanding today. That being said, it's also, of course, a personal decision, but it's important to know that although in the United States you are protected for you are protected for health insurance and employment through genetic testing, you are not protected for long-term care insurance, and you are not protected for life insurance with that information. And so that's really important to think about when you're considering going forward with a genetic test for ApoE. You already have as much information if you have that first-degree relative, but again, it's a personal decision, so just make that decision being informed about what that might mean for your future.
And that's interesting what you're saying about planning the future, because obviously we see all kinds of scenarios. Individuals that, it's always nice to be financially very capable to pay for all the care that you need and be placed properly. But the reality is many individuals do not have the means to either place their loved ones or even place themselves in a facility that's catered to an individual who suffers from Alzheimer's. So what are some of the options or planning that, let's say we're talking to someone now who's not yet diagnosed but needs to think about something like that or is concerned. What are some of the thoughts that you have or recommendations about better planning?
Absolutely. So if you are concerned about yourself or a loved one, or you had a parent and this is something that you're thinking about, those are types of conversations that you should have with your financial and your legal expertise. In fact, the Alzheimer's Association has an entire educational workshop that you can do either on our website at alz.org or in person at one of our chapters across the country.
That's
to
phenomenal.
Really get an in-depth expert opinion about what are some of the things that you should be thinking about. How should you structure your legal affairs? How should you think about some of your financial opportunities? And you can access information about all of that at alz.org.
Perfect. This is phenomenal. I knew about a lot of the different services that the Alzheimer's Association offers, but I didn't know that this one is available, and that is phenomenal to know. Just because coming again from a clinical perspective, that is such an important and fundamental area that must be handled. And
Absolutely.
that's great to know. Now, what are the types of clinical trials that the Alzheimer's Association has right now? Maybe we can talk about some of them that have been successful, and then some of them that are available for individuals to join or to be considered as part of the clinical trial.
Absolutely. So there's over 200 ongoing clinical trials right now for Alzheimer's disease and related dementias. And in fact, they are at three different stages or three different, before we have anything that's approved for use in our medicine cabinet, it must go through a fairly regulated process by the Food and Drug Administration in the United States and regulatory agencies in other countries. And that's called a phase 1, a phase 2, and a phase 3. Phase 1 being really looking at safety of a drug. How safe is it to the individual? Phase 2, continuing to look at safety, but also looking at the potential dose of that medication that might be acceptable to an individual. And then phase 3 is asking the question we all really want to know the answer to, right? So if you're talking about a drug that you hope might stop or slow, an experimental drug that might stop or slow the progression of the disease, that you're looking for that information in a phase 3. And so actually, there are, again, over 200 really spanning phase 1, phase 2, and phase 3. I think one of the things that we've really seen in the last 3 years is a diversification of what's coming into the pipeline. For so long, many of the clinical trials really targeted the beta amyloid protein, and that's that protein that clumps together in the plaques, one of the hallmark brain changes. But we started to see an emergence of experimental drugs targeting the tau protein, which is that second hallmark brain change. And in the last several years, we've seen things that are targeting our immune system, which we know is playing a role, the brain's ability to metabolize various energy products for its food and for its nutrition. What was something we called neurotrophic factors, which really are factors that help to keep brain cells healthy. How can you make brain cells healthier and possibly withstand some of the surrounding damage? And so we're seeing those types of trials and targets entering into clinical trials. We're also seeing an emergence of what we call repurposing, meaning that we're taking information that might have been, or experimental drugs that might have been developed for cardiovascular disease or for cancer, and we're seeing them being tested in Alzheimer's disease because of the commonality of some of the underlying biology. And that allows you to, in some ways, move things a little bit faster and move into clinical trials a little bit faster. And that really offers a lot of promise and a lot of hope.
Where would individuals go to online to find out more about the clinical trials that are available?
So you can actually go online at alz.org/trialmatch, one word, TRIALMATCH. And this is essentially, you go on Trial Match and you can fill out a profile. It's almost like an online dating service for clinical trials in your area, right? So you can go on, you fill out a profile, you get your matches, and then you're able to get the information about what's the trial, what's the information, where's the site, what is it, what are the obligations to the individual, what do you need, all of those kinds of pieces of information, as well as contact information to reach out and potentially enroll. So it allows you, it empowers you to really make that decision and understand everything that's going on in your local community or whatever geography you're willing to travel or wherever your loved one is. It also allows you, it's not just for people with Alzheimer's disease and related dementias. It could be for healthy volunteers. They're needed for clinical trials too. There could be online surveys about perceptions of disease. There's a whole lot of different types of studies that are out there. And so it's really a way that we can all impact research in our just by in our day-to-day lives.
Wonderful. And then I'm going to, bring up now the $1 million question. And I call it the $1 million question because it comes up almost every single time in my experience. Proteins. So always the confusing question. Well, is protein destroying my brain or is protein helping my brain? Should I take protein shots or treatments, or should I avoid protein because it's going to increase my chance of developing Alzheimer's?
Yeah, so I think it's important, and that's a great point, and I think clarifying some of the language. So we are all made up of proteins. That's something
right.
that there are
Right.
so the beta amyloid is a protein, and the tau is a protein, and those are things that we need for a whole lot of our everyday functions, right? So there are our brain cells are made up of proteins, our
Muscles.
skin cells are made up of proteins. Every cell in our body is made up
Right.
of proteins and has proteins as part of its function, right? So that's something that we all have. But then there's also, I think, the other use of the word protein, which is our various, nutritional pieces of protein and what that means. And I think at this point there is nothing that we know of that will stop or slow the progression of the disease. There is no specific supplement type of way supplement, including protein supplements that are available that have been shown to be able to have benefit or potential harm for an individual. And it's really that idea of a balanced diet. What can you do to be as balanced as you can be? Same thing goes with whether it's a protein shot or however you deliver it. It's really a balanced diet to keep your brain as healthy as you can be as you age.
Right, and I think it's important for people to know that there's at least that we know of about 20 types of proteins in a cell. And they are all grouped in different ways, and they all have different functions. And it's not the answer is not simple, and it cannot be simplified to, well, is protein good or bad? Protein overall, like you said, is very essential, and there's all types of proteins that do all sorts of things in our body. And I think that there needs to be also some cautious with thinking about, protein shots and what protein shots do to us. Something that I thought was very interesting, I remember talking to one person who said, well, every time I take a protein shot, I feel that my brain is doing better, which very quickly translated to what we know about the placebo effect. And in fact, there were studies coming from UCLA and other universities about the powerful impact of placebo and treatment for in the aging world and treatment for dementia as well.
Well, I think that's and part of what we do see is that's really part of where the benefit of participating in a clinical trial comes from, right? Is right. That you have that engagement and that that potential, and whether it be the experimental medication or whatever that is, and that's part of the benefit of participating in a clinical trial is going forward. And in fact, we do see that there are lifestyle studies that are happening, so things that are really pulling out or putting together, and I talked about them a little bit earlier, some of those studies that are looking at lifestyle recipes of intervention. So the idea that maybe managing your cardiovascular risk factors, so things like your weight, your blood pressure, your smoking, all of those things, and managing that. Having nutritional guidance for a brain healthy diet, so dark leafy vegetables, low unsaturated fats. That really putting those together with some brain training or some computerized brain engagement, along with some social activity and physical activity, and it was that entire combination that was beneficial for keeping our brains as healthy as we could as we age. So there are also those types of clinical studies that we can engage in today as well.
And I'm going to repeat some of the things that you said again, just for our listeners to hear. It is a lot about lifestyle. That's what a lot of studies do show. A well-nutritioned diet that involves a lot of types of vegetables, antioxidants, and good fats. And we talk about that on the show. But the diet is very important. Moderate exercise, mindfulness and relaxation, breathing exercises, which, by the way, go into that mindfulness, reduction of stress, cognitive stimulation. You've mentioned a lot of very, very important areas, but it's sort of like the holistic approach of saying, I'm going to make sure that my regulatory system is maintained, and by that supporting both, I think, the actually vascular and the vascular system overall, so heart functioning and brain. So I think that's as you said, very, very essential. One last question, and time really does pass by so fast. in terms of resources within individual states, so that's another question I often get. Well, what could I find out, or where can I go in my state to learn more about where I can get some help or services?
The Alzheimer's Association is all across the country and in communities all across the country, and can really both provide resources and support, but also connect you or your loved one with resources that might be in the community. And you can find information at alz.org or call our 24-hour, 7-day-a-week helpline at 1-800-272-3900.
Yep, we've got it posted right now live for everyone to see. And as always, of course, our listeners know they can reach out to me, to the show, if anytime they need to be maybe referred out or find out a resource that they've got around. But I think the Alzheimer's Association is just a great place that you can get all sorts of information and really covering many different areas, both from basically everything we covered today, both from the care of the individual, knowing more about diagnosis, where individuals can get services, and what types of trials and studies are out there that are promising. With that in mind, again, Dr. Snyder, I really want to thank you for coming on the show and educating our listeners, and for all the amazing work that you're doing and that the Alzheimer's Association is doing. I have to say it's been an incredible experience, even for a clinician such as myself, to be able to send individuals to get quality information and services. So again, thank you very much for being on our show.
Thank you so much for having me.
And with that in mind, for our listeners, we have some great topics coming up in the next few weeks. As usual, as you know, we are going to target some unusual articles that are out there and some conditions. So tune out to our Facebook page, The Dr. D Show, to learn about the experts that are coming on board and topics that we will cover. If you have any questions, concerns, ideas, or areas you wish to hear about, go ahead and email me at www.drdgaines.com. Contact at drdgaines.com. I would like to wish you a well-informed, healthy, powerful, and meaningful rest of the week. Be well.
You're listening to the Dr. D Show about neuropsychology and well-being. Get the knowledge you must have to live a powerful, positive life. The Dr. D Show. Here for you.